Well, Fambul, una good afternoon, and also we welcome to una to we will body program what we call Wetin D Docta Say. Well, Wetin D Docta Say, this na well body program where the SLBC bring camp, we can usually bring camp to me and you for lay we know about different things them where the money we. And this program always we can bring camp people we. Now, master sabi people empower body business working Africa work more than some of them topic them, especially thing the way the money me and you. And today on topic, all the talk was that is sickness we common amongst you, all they call malaria. What me way they bring this program come to you? Me na Emmanuel Samoa. Well, the family, as I say, we can always bring this program come to una and we all follow we learn some things then from the doctor then as to what they waiting they happen when we do certain things and they or how what are some of the chances we'll get for survive in certain situations or why we know for take certain medicines then. Well, today family inside the program waiting the doctor say we dey talk about malaria and the master sabi person when we get to the studio for talk about this particular sickness. Now we call Dr. Solomon Falafua Sandi, a medical doctor attached to the Koidu Government Hospital. Good afternoon, doctor, and welcome to the program Wetin D Docta Say.
Good afternoon, Emmanuel, and good afternoon, family.
So, you know, we announce and say it's the own program we they talk about malaria. So, who say malaria? In common terms, as a doctor, what do you mean?
Thank you very much, Emmanuel, for the question. So malaria common to we as Salonia, and almost everybody acts outside who don't hear about malaria. But malaria is sick where it can affect everybody, even though because we don't get an apple something, we get specific group of people that we're more prone to it. But it get the tendency for cause serious illness and also get tendency for cause death. In fact, from we Ministry of Health, malaria is still the leading cause of death among Burkina and Salon.
So, what is the cause of malaria?
So, malaria is sick where a specific type of mosquito they transfer from one person to another, and very rarely it can also be transmitted when they keep us in blood or the use of sharp. But the most common route of transmission now. Mosquito, we then call it female anopheles mosquito. We bet somebody we get them and go to another person we not get it better. It transmits the tumultua and the tumor will grow up in the person body and cause the malaria sick.
So we usually we like say na woman mosquito na in the bet somebody get malaria. And they wonder why na woman mosquito for bet person before person get malaria.
So now a specific type of mosquito, you write saying that the woman variant of that mosquito today, but not so because now woman also not just the way God designed and that the female mosquito now get the capability for transfer the malaria parasite.
So what you say now is specific type of mosquito. Is it that we other mosquito that we go bet you no get malaria?
Yeah, you get different varieties or different, just like how we humans then different. Me like you like, you get various species of mosquito then. So now a specific type when are the anopheles mosquito, and even the anopheles now just a female anopheles mosquito they go transmit malaria from one person to another.
So you talk say usually when doctor they say the mosquito or the mosquitoes we usually call them, they transfer malaria from one person to the other. People go there, someone go me I can still wonder how that mosquito they get that kind sick, that kind thing the way they go get to motorman.
Okay, so the thing is the mosquito they transfer. So for able transfer means somebody for the way forget malaria first. Where you can get and suck blood. In that process where they suck blood, just like how every mosquito they suck blood from we, they take off the malaria parasite. They move to somebody else we not get, they get them for also suck blood, and the parasite they move from the mosquito to that new person we not get. And so now by that means they transmit the parasite.
So you talk say you get even though malaria Oma you don't say Oma can get her, you say study don't advance and show say you get more people that way more prone. Why you get this kind of condition?
Okay, so the way God made everybody, and the fact say the moment you dey get specific attack from a specific group of lost a specific person, just a scenario, your body self they develop defense. So if you don't get attacked severally from malaria, the body they develop some kind of defense. So for example, me and you, we still go get malaria, but then the chances it will become very severe, different from person where something a small picking, we not be not exposed to it before. So the more you get exposed to them and recover, the more your body they develop defense against them. So the one that way more prone to, of course, now picking their way they less than 5 because they not don't get there attack them before. People that way they travel, let's say somebody come out in a place where malaria or the cancer alone, that's higher risk because you not get any defense that we me and you don't develop now. So and people that we get HIV and AIDS, for example, and can also be prone to malaria because their own defense is also there. But like I say at the start, we all possible forget, just that the severity from one person to another can mainly depend on whether you don't get them before or not the first and then the way you get them.
So where una can say where mosquito can bet somebody, for example, if me get malaria, then you not get the malaria, then the mosquito can bet it can suck me blood. Now the tumbu, that blood don't suck, they change into tumbu, now the tumbu they go put at the other person body on a way till they go up there.
Okay, so the process where the mosquito they suck the blood, the tumbu can, of course, now tumbu they didn't have the blood. So as they suck the blood, they also they suck the tumbu with the blood, not to like the mosquito they go change them to tumbu or whatever. Wherever the mosquito they suck them from, the tumbu already didn't have the blood. They go there, then within the mosquito system, the tumbu they go within the system and they settle at the part of the mosquito where they bet. So the moment you go bet another person, they move from that, I can say months for let people that understand where they use for bet and go into the new person blood and then cause malaria for the person.
So look at the kind of small blood where the mosquito in the bet to it. You where the bet to you get to buy to kill mosquito, you say the blood is small. You know, then when you see the blood, like where is killing the mosquito, you see say now so water. So one go ask waiting at the possibility say tumbu inside that water. So that tiny blood there, and tumbu there.
So the tumbu so tiny that you not able to see how it naked eye. So that means even a single dog can get thousands of them because you're not able to see how it naked eye. Even if you go do tests, a microscope then we use for SIAM because it's too small and tiny. So no matter how small the blood is, it's still possible for carry out for transfer the malaria from one person to another.
So you get other when you look at salon, you know, malaria usually when somebody sick small, they say malaria. And you find out say we even the see malaria say like common to me. You know, why is it that malaria is so common as salon as opposed to other parts of the world?
Yeah, so not to just Salon, the entire of Africa, malaria common. In fact, according to the WHO 2024 report, nearly 95% of the cases of malaria are from Africa. 95% of the global cases are from Africa. Well, with climate now one, but also malaria, of course, some people are not say it, but a secret preventable and also with treatment for. So we can able to prevent yourself from malaria from cleaning the environment, for example, getting mosquito nets. But salon, of course, near UPIP, if you go down the street, how much dirty you will see in the street, just back of the studio, how much you will see in the gutter and everything. So all of them, think they're not, think the way they put you at risk of malaria. In other places, you not get any kind of environment. So the mosquito not get side for breed. So now they make, for Africa, get 95%, but Sierra Leone are also one of the countries where there's very high burden of malaria. Of course, as part of the report, even the deaths for the entire of Africa in 2024, you will get 6,600, about 6,600 deaths for malaria. Of that number, 2,600 are from Sierra Leone, and roughly around 40% of the entire Africa deaths now be from Sierra Leone. So Sierra Leone are one part of the country away Of course, countries like Nigeria, they are ahead of Salon when it comes to malaria, but Salon gets a huge number.
So you mentioned you say people that they get exposed to malaria. So how can somebody can get exposed to malaria?
So the most common thing we common in our environment, because for letting mosquito, like I tell you initially, the mosquito need to transfer. For letting mosquito breed, you need environment where comfortable to and for breed. And the side they usually can bring and then dirty place who say water settle will not move. Now then kind side they breed. So the mosquito will boku. If we check now Salona, the number of mosquitoes would all increase compared to other side because we get a lot of the water collection, then dirty places. We're very good for it to move forward. So danding are part of the reason why I make Salon, I say we all there at risk because we all the environment. If you check now one community will you know meet dirty water settle or then park dirty in the street or some other area we will serve as a breeding ground for the mosquito and also put you at risk of malaria.
So from what you just said, Gigi, so you say 40% of the deaths die from malaria across the world according to a WHO report, you know, in from Sierra Leone. So somebody out there would wonder, say, malaria really they kill?
Yes, so malaria can cause very serious illness, and especially among them who people are telling, and you get very severe complications. You get picking their way, go get malaria, maybe they're not handling well. At the end, they end up blind just from malaria. You get picking their way, go get malaria. At the end of malaria, they develop some mental issues where they may go to school, they may do anything. So malaria is extremely serious, and you get tendency for called serious illness, especially if they're not detected early and treat them early.
So we don't talk on some of them here. So what are some of the symptoms, you know, where somebody will see, say, I don't get malaria? Because several times, you know, so telling the way you add somewhere and some person say, no malaria, you don't get so. So tell everybody begin add small body one say you don't get malaria. Or so tell you what tiara, they say you don't get malaria. So that's one of the signs and symptoms where somebody they say, oh, I don't get malaria.
Okay, so malaria not get specific signs and symptoms. So when this acts or when this happen to you in a malaria. So you get non-specific symptoms, but usually it can involve fever, tiredness, and some people can get headache, some people can vomit. So you not get specific symptoms. So the moment you get one body, malaria. So, but nearly everybody will get malaria, will get fever, will get headache, and depending on how severe, it can get some people who will present in the hospital they're unconscious because of malaria. It gets people who will come hospital sometimes with altered consciousness or maybe with low sugar. You get various ways where you can present. So you not get specific symptoms. So the moment you see this and this and this, like malaria.
So one common thing where I don't know if na meet that day or if not to true talk or if not true talk, that if somebody see the weather, see you wet here, like say, you don't get malaria.
Yeah, so yellow, when the wet yellow or look brown or look bloody, it can be a sign of malaria. But not to malaria normally cause that. You get some people who will come the eye yellow. It can be malaria, but not to malaria normally cause that. So like us, you get non-specific symptoms. You don't get any symptom where you go say, oh, the moment I see this, not malaria. You get some people that will have convulsion and they get, but not malaria responsible. But then you get other things that will cause convulsion. You get some people that will go just bleeding, especially bedroom, and they will just start from bleed. Normal. You get other things that they cause, and few times it can be malaria. So you don't get any specific symptoms. So the moment you see A, B, and C in malaria, but then you get several symptoms where the person can go into the hospital.
So malaria gets stage or type?
So malaria and malaria, those are to move the way they cause them. You get 5 types of them, and of them, you get two-way common. The most common are they call them falciparum, which are the most common, and of course they are the most deadly one. Then the malaria can be mild, it can be severe based on how the person presents. So man will just come with headache and fever. You do test and malaria, and then a mild malaria. Some person who come to hospital be unconscious and still malaria, but in that case, not severe malaria. So malaria can be mild, it can be severe, and the thing will determine whether this person will get mild or severe. One, whether you don't be exposed before. Two, how early then detect them, because even with me and you, if you not detect her early, it can move from mild to severe malaria.
So you talk about the most common malaria. Now you say falciparum. What you say? Which kind of type of malaria than they? I can look like where somebody get tired.
The only way that they able to differentiate all these in this specific tumor we get where the malaria parasite or this person and this parasite, and all the way in the microscope, the presentation all are the same. Whether I get falciparum or get any of the other types, the cancer are 5 types, but of course not go on board people with that. But whichever one you get, now the same way they present. Now only now the lab and we will differentiate, say, oh, now this type or now that type or now this, and also based on the type, they also determine which medication might be effective. And of course, with WHO, they also they think say people are not start for because of how they use the medication. Then people are not they develop some resistance to some of the medications. So then they all can determine the choice way the doctor will use for treating.
Yeah. One of the things we can usually happen when somebody get malaria, you know, even medical practitioners them, they say I say malaria and typhoid. Like my brother and sister, they also go together. We get malaria, that means you get typhoid. Is that so?
So, in the first place, typhoid not as common as malaria. Yeah? And for me, most of the time the way the clinic or hospital will tell you say get malaria and typhoid, most times it's not correct. Because typhoid can cause very severe disease, and I don't remember when last me actually treat typhoid. Because even the tests that we widespread at the hospitals for check for typhoid, no, actually they check for typhoid, they're not specific for typhoid. So most of the time we will go there, do a sample, oh we get typhoid and malaria. The actual fact is not correct. So that is not a true thing, not a true statement. Typhoid not as common as malaria, and typhoid they cause very severe disease.
So you know say technology don't make it simple now that and get a malaria test kit where somebody can go buy in a pharmacy or test. So if somebody buy that test kit, the test itself for malaria, is it that test kit will show what kind of type of malaria they get when the person get for the medical practitioner going for say okay, I prescribe for you so and social drug you take.
Okay, so then test kits and they're useful, and then they make in fact they develop them. They call it the rapid diagnostic test. We may you can even use that CDI and check whether we get or not. So the moment you check with that test strip and it shows that you get, you can take treatment. You can go to the doctor and ask for a treatment you take. You don't necessarily even need for no say, oh, na falciparum or na any of the other type. The medicine the way available to work for all the different species of malaria. They accept in very rare cases where some people will not develop resistance to specific medicine. In that case, they can need an additional intervention.
So one other thing we usually go watch, most times we they can say okay, this person get malaria, they say okay, they get out typhoid, and the type of drugs that we people can take. Because you know some talk to you somebody say you get some usual containment or that kind of thing, the way you take in the main malaria. Is that so?
So I don't go too much into country medicine, but my advice is we get effective with my medicine that we do. We actually don't need country medicine for. And the good thing is most of the medicine now within 3 days you don't take them. So the best thing is when you get malaria, you go to the hospital and prescribe for you the medicine. You can once you don't do the test and you confirm, you can even go to a pharmacy buy the medicine instead of using country medicine, because the issues with country medicine, of course, I'm not going to say they're not effective, but one, we not do any study for no say this they work or not they work. And even if you work, you also not do, they're not going to measure saying at this quantity for take, for example, the tablet. If you take the malaria tablet, I will tell you this not 480 milligrams, this not 20 milligrams. So I know the actual strength with the take. But then they can be different with country medicine. You will take more than me and they'll get their own adverse effects. And so me not going to advise anybody for go for country medicine, because we get very effective medicine within every pharmacy in this country, except in a village you get one small pharmacy, malaria medicine available. The only thing do the test, confirm, and also go to a hospital or go to a pharmacy and get the right medication instead of using traditional medicine.
So we will still talk about the medicine business. We say we get different type of medicine that we can inside this country. One, so what do you wonder say, why will somebody take that medicine and not sick malaria again? Why?
So except for picking the way that they vaccinate now, where even with the vaccine not to like 100% say no they get malaria again. The medicine that we are available now for treat you. So they can treat me today, 1 month later I contact mosquito, I get malaria back. Not to consider the medicine they present you say no will get malaria in the future. Just that this current one we get is a treater. Except for picking them now in 2024 President will launch the malaria vaccine where EPI don't I'm sure they don't go far with distribution nationwide, where the target picking the less than 5 years. We have 4 shots of the vaccine in the game. So that vaccine they help for reduce the chances of getting malaria, even though not to fully say anybody they ever get malaria, but they reduce the chances of getting malaria. And in the cases where you get malaria, also they reduce the chances of getting severe malaria.
So how bad malaria sickness stand?
So malaria is extremely bad, especially if you know diagnose them quick and you know treat them quick. Now a sick way can kill person within 24 hours. If you know detect them early, treat them early, it can kill person within 24 hours. So it's extremely severe.
So is malaria a contagious disease?
No, not a contagious disease. You're not able to transmit from one person to another. For say, oh, you come here, you carry it now in one bowl, you will give me or I greet you or me, you sleep in one bed. No. The only real chance is for let transmit from one person we can say now with sharps. Because if for example I use needle now and choke myself and the same time I choke you, possibility they say that small blood will come off from me gets the malaria parasite, and while the choking can be transmitted, just like how the mosquito they transmit.
So
but that are very rare, not
so,
like a common route.
So that make it happen, because this is like news to me. Where I believe say somebody will they watch you back will be news to and say malaria can be transferred to that way.
Like I say, very rare, but it's possible for be transferred that way, or even with blood transfusion. So for example, if it's an emergency and I need blood, immediately then just take the blood, go give you, it can be possible for let me transmitted as well.
Okay, so Fambul, I hope say you don't enjoy and you don't really understand from waiting Dr. Solomon Falafoya Sandi, when a medical doctor attached to Koidu Government Hospital, which everything don't they say about malaria. You don't talk so many things about this malaria sickness here. So well, family, welcome back to the program you watch now. Wetin D Docta Say, we come to you live on the SLBC today. On the what will they talk about now? Malaria. Malaria come on among we all, and malaria we talk about. And we get Dr. Solomon Falafoya Sandi, when a medical doctor we attach na the Koidu Government Hospital. Now in the help for Rob months by this particular topic for we, what they call malaria. And malaria as something they affect you. They don't talk so much about this malaria also. And it will twist in the studio. We will continue for the ask questions then on different things then. We will talk about the myth Which are some of the message people can give out about malaria. Maybe we will say na two or not two. So it's still a two and it's still and doctor, let me talk about this malaria. We'll talk about the preventive side. Malaria na sequence of what they do for prevent.
Yeah, so malaria are very preventable, and you can get, I can say nearly 100% success rate in preventing. So it's a very preventable disease.
So why, as a nation, first we never prevent malaria? Because when you look me, from my born, tear on big man so I sick malaria. So and still we never prevent malaria. It's still a bet plenty people. So if it preventable 100%, why we not go for prevent them? What's not the problem?
So it go down to individual level. Government can do their own. So for example, government or roll out vaccine, and they keep picking them. But then me and you get a lot for the way not to government for the way. So for example, the car say initially cleaning the holes, cleaning the compound. Not to government will come for person for can clean your own compound. So the prevention you know will get so the agent will transfer from one person to another will be absent. So cleanliness now like a key for that we able to prevent malaria. As a community, you can come together as a community, not we clean the community, go, no need for big government, no need for big military, no need for big police. As a community, as to go host to host, clean every side, care for prevent malaria within the community.
So you talk about say this transmission, we still you talk on something you saw this transmission where I forget for ask you, I still can ask you, where the woman mosquito don't bet person, how much days it take for the signs and symptoms of malaria begin showing itself?
So usually now between 10 to 14 days you start to get signs, but again it depends on your previous exposure. Some people can get several bites and say you only will start for show with the parasite count are extremely high. That time they will show for certain group of people. But usually now between 10 to 14 days they start for show symptoms. 10 to 15, 14 days. Yeah.
So for me research I find out say malaria na one thing really cause anemia.
Yeah.
Why malaria they cause anemia? Why for lady other sickness back?
Okay. So anemia on its own not to like a sickness, it get different things the way they cause them. So it just means the blood level go down. And the thing will make malaria the cause them because when malaria go, the red blood cells when one pan the cell level gets now. One pan the cell level gets now with body. The 90 malaria they attack. So they start for destroy the red blood cells and as they destroy them the blood level will go down. So that's one pan the way they with malaria because anemia.
So where this you red blood cells that they go down? Because anemia plenty people know and say now way somebody not get better blood. Why malaria for carry somebody blood dry? So malaria about to make person blood dry?
Well, not to dry, but the thing that we then they check for say you get anemia or not and the red blood cell. Usually now you can call her HP then they check. And the HP now the red blood cell they carry. So if you not get, let's say you not get transporter for carry certain thing, then that thing they not will be available for you. So malaria can cause positive blood for go down. In fact, one pan the leading cause of death we person get malaria, the anemia, especially in picking them. The leading cause of death.
So then where people like you say for treat for malaria, most times like you say na anti-malaria for use that tablet. And sometimes like in day I don't meet up somebody where they treat me say they ever treat malaria without blood serum. Some other medical practitioners say no, they treat malaria with blood serum. So which one parallel right?
So the extent or the full treatment that they give person depend on the person in condition we carry it. You can get two people that carry with malaria. The one get malaria and we also don't get complicated by anemia. you get another person wey na just malaria. Why I say complicated means you get malaria, but we'll check your blood level go down, go down. So then two people are not to the same treatment to go give them. The one way blood level don't go down, depending on how low you go, in fact, we can just get a blood syrup and the malaria medicine. Or if you don't go extremely low, we will need for transfuse, get a blood syrup, blood tablets, with the malaria medicine. And you will just come with just malaria with no complication, then we just give the malaria medicine. So the choice of medication or whether na one medicine they receive am with other medicine depends on the way you present to the hospital.
So when you talk about the way you present to the hospital, most times when people can sick malaria, you can just go to a pharmacy. So the only way the pharmacist could do or something, you meet a nurse there, now just for take that malaria pack, that one they send a pharmacy and test you. So this person gets malaria, the parasite will put that. But nothing day and that way for sure say this person blood don't go down. So how then they know say this person blood don't go down? Because this particular side, so now something where I don't, if you miss a the person say no way they treat somebody for malaria, you forget blood. Another person say when Americans no, you don't forget blood. So if they talk say now they check how the blood level or they put all man get money for go hospital. So how that medical person dey for no say, or I the manage no say, or how something me as a common man no say for no say the blood it don't go.
Okay, so for medical people, in the first place, advise pharmacy now for just go buy medication by the standard of the laws in a salon. Pharmacy now for even they do them test them or something else. Just that because malaria common and the test kit are available, it's allowed that they can do the test as well. But because malaria can get other complications, it's best time for going to hospital. But in a situation where you not go to hospital, the person whoever they give the malaria medicine can look at your body, maybe the way you are the way you found and see say, oh, this person to take blood on go down. Even the one way they can hospital where they don't see them blood on go down. Most times we cannot see watch them person and see say, oh, this person blood on go down. The tests are more or less for confirm within it. So it depends to the health practitioner we meet. But my advice is always go in a hospital, not necessarily big hospital, even the community centers, then get the facility for check and no say you could need malaria medicine plus blood medicine, malaria medicine only or as a case may be.
So doctor, you say you check somebody eye and you go no say this person in blood they don't. How somebody they check? How you do know say this person blood they don't? Because Wetin D Docta Say that this program they watch. For we help for tell we learn we which we don't understand. So if you tomorrow until I see me small one or anybody who watch us, will know say this is blood they don't, they go to hospital.
So actually some of them things they nothing the way they part of we training, we make we training long. So of course I don't go within 1 hour and it will explain all things to you. The moment made the work with how many see the patient and the same way. But however, you go see the person and the whites compared to other people. You get people when not even go to school. The moment they only answer and say, this is not get blood. The hand go white, then the eye inside so go also white. As you said, we know this and blood don't go down. So now basically now by that, but not to everything I will explain to you, you understand. Because something in the past you see, don't practice for some time before you even get that skill. So like I say again, the best thing for or go to hospital. And another thing, maybe go ask lad it just come to my glad just okay. For most times we don't need injection for treat malaria. You get a lot of people away sick malaria, go to hospital, we get tablets, say no, we need injection. I want. Why drip?
Why you say we don't need injection or drip?
So whether they give drip for malaria or they give injection for malaria, the interesting thing is that we don't like still take the tablets if you want to get the malaria done. The reason is the drip, the injection, they make them for severe cases. So if, for example, patient can with malaria, you're unconscious, you got malaria. And we can say, hey, Emmanuel, we can give next later. So in that condition where you need to get a medicine. So in that case you can get the injection or the drip for cure the target the malaria. But the injection and drip not completely clear out everything. So now I make regardless of the condition, where you take the drip or the injection, you still need for take the tablets for it completely eradicate them. So if first unconscious, the vomit, no need nothing for take injection. Because if you take injection, you still need for take the tablet if you want to get a cure from the malaria.
Doctor, this is not news to me because I don't with tell suicide somebody where they want gear. When they gear malaria tablet, tell the medical person say, I don't want to give me the and then gear and drip injection, that's all. So where you can say the malaria not the many side person, I don't understand.
So it's not completely clear. Like I say the injections, all injectables we then do them for target severe cases because you therefore fight against time. And if, for example, at the give drip, the medicine they go direct into the blood compared to what take tablet, you get for go first and the guts, pass before the body suck and they go down the blood. So it takes some time. So in a situation where you need for you want the treatment for starts now, like I say, forcing the vomit, you not go angry and tablet, then not vomit the tablet. Or forcing cry unconscious, or you see say these are very severe malaria, sometimes the parasite count extremely high. In those situations, it's okay for the injection and target, but whoever you give injection at the end, you still need for take the tablet for completely clear out the malaria.
Wow. This why you don't can open it. I don't say somehow go sit down now also go watch. Somehow in say in medicine no get business, he go say this doctor not to be talk because they give me injection very well.
Yeah, well, you will feel better because the count of the parasite will not reduce. You just feel like if you get let's say get a community where people that they can attack, the greater the people that they can attack, the more you will notice in your community. For example, now one person no more can attack. Just something just the one area around that area, then they will know say oh possibly people attack the community. But if you get 1,000 or 2,000 people in Qatar, everybody in the community will know so that the attack will get war with this person. So similarly, the moment the malaria parasites don't reduce, you can start to feel better. You get people where even they take tablets until after you take the first two, they feel like completely well. You feel in way they get like you don't completely well. But in actual fact, you still get remains of the malaria parasite. So I think even the tablet they're given now for 3 days. Even if you start to feel okay, for example, now maybe in the atomy, but even the one, I take 2 tablets, it don't stop, I not for stop the medicine. I for still take them for the 3 days course because waiting to happen, the parasite count they reduce, and when you reduce, then symptoms the way they get they subside. But it don't mean say you don't cure. It just means say you don't feel better, and the malaria don't a bit they under control. And if you want for clear out, you need for complete your treatment.
So doctor, what about them people away can drink the continue? Because you don't talk say possible to them tablet and they, what about them people who can drink them continue medicine? Because you see some people they pass with, I'm not saying you prove it to them, prove it to them and they I don't get any proof for sedating anything men malaria because when man say we drink get malaria.
So like I say initially, the thing about country medicine, one that we not do, most of them we not do study for the whether this they work or not. So most of them medicine they take so now we kind of packet they take. They can don't test and force among animals and so tell them rat, other things they see the hope. Then take blood sample, test and a lab, see the hope. Then select few people and we get, then try the medicine and see before they roll them out as medicine for the one man buy. So you can go through all and process them for just for ensure say one the medicine they hope to get adverse effect. Now that they different from country medicine. I can just go down the backyard and pick leaf and can use I don't put medicine for malaria. But the risk is one, we not do any study for no if they hope. 2, we also they get problem with the strength we take. If now the medicine, malaria medicine they go back will tell you say, oh for you wait, take 2 tablets, for you wait, take 3 tablets or take 4. But with country medicine I will just turn and a call. that one wey dey turn am cup, the thickness may be different from the own, the strength wey dey take may be different, and all of them thing there, even the medicine they will take, each of them gets their own side effects. Even though when they develop and they can all outweigh the negative and the positive, then they decide, so, okay, this they do more good than bad, and go that man. So even the malaria medicine, for example, if you take an overmark, it can cause additional problem with you. So now the issues are the way me get with country medicine. One, we don't know if you know. Two, the problem with dosage, whether the right strength they take, the wrong strength, and of course the side effects. They will not do any study for no say, oh, this medicine has side effect this, and at the end, if you talk to the kidney doctor, and they will tell you say kidney disease and they increase as alone, and one pound they come on risk factor for another country medicine. So then I make it advisable. The medicine available, expensive. They are available. Before you take country medicine, just better you go take them within 3 days, you don't recover.
Doctor, how that thing back way kind of mind? I know of somebody he say every month they take malaria treatment. Whether I well they take malaria treatment because that they help for not get malaria. Is that advisable, or now one of the is it one of the ways for somebody prevent himself from getting malaria?
Yes, so you get medicine the way you can take on a routine basis, way they help for prevent malaria. So, for example, before maybe doctor had to come up, he gets medicine way, even they give me every week, every Sunday. Some people on a Sunday, some other days of the week, or every 2 weeks they can give medicine the way they prevent. But it gets specific medicine, and then even most of the people that we come out country that will not get malaria, as part of their policy, whether they come here, then they give them medicine that they take, where they help for prevent. So that's a way for prevent malaria, but it gets specific medicine the way that they do use, not to just any medicine.
So what about anti-malaria? Then normal medicine that we can take, we get malaria. If I take them, I'm not even sick, it prevent people from not getting malaria.
So the advice is, if you want for the take medicine routinely for prevent, the best is you go to the hospital and they can decide which one work for you. So some of the anti-malaria, of course, they can use as prevention, but not to everyone. For example, me now, because I know I'm malaria every week, I go take injection, or I go buy this specific anti-malaria. So the advice is you go get a discussion with your doctor. So, because of malaria, I want for the take medicine, then go prescribe the right one for you for the take, and it will help for prevent.
So, doctor,
reduce the risk, not to completely prevent it, but once you don't take it, you don't go get time again, but they reduce the risk for it.
So, doctor, one other thing we come to mind now, the way at which we get plenty different anti-malaria medicine on the market, and there is some medical persons that say, no, take my fan, some other person take, take 444. So now all our person says, take this. And in all of their anti-malaria tablets there, so which one are the one where you feel as a doctor, it's necessary for this somebody if you wouldn't prescribe them for if you don't prescribe them for take them.
Okay, so most of the medicine they will deal with different names. So for example, take Ronald, Bicotem, Coartem, Lockmal, they all have the same composition they get, and the same medicine. The difference in names now because me produce medicine, I want to sell and me produce them, I call her Solomon. You produce medicine, you call her Emmanuel. But the actual two mix for getting medicine are the same two mix. Just because I'm a maker. Let's say for example, birthday cake, you make birthday cake, you call her Emmanuel's cake, you make birthday cake, I call her this. So all the medicine, they're essentially like the same medicine. Now just based on the pharmacy producer, the brand we produce, and they can give them a different name, not to anything different. So it depends on, so usually when we can prescribe, I will tell you, I prescribe this for you, but you can go by the one we usually take. No necessarily take, so because I don't like to know that now, I know that no more if I go by. So usually when we prescribe, I will tell you, say, I don't like to email fan, but go and buy any one of the we use for take. Because again, difference in their prices. So you don't go first person for take. But essentially they all are the same medication.
So they all are the same medication. So you want to see Malfan, Lunat, and 444. They all are the same.
Not the same. Not just the person way make can get different name. Pharmacy way make can different. Even though you get other anti-malaria, then so for example, you get fancy that when 3 tablets they take together, you get another brand when 1 tablet they take per day. But they one the way they take morning, evening for 3 days. Nearly they all are the same medicine, and just would produce and get a name, or would count and salon get a name.
So and all of them tablet and they before you don't take out blood syrup or not.
So none of the way get rules say for take out blood syrup. The thing where they warrant you for take out blood syrup the cast initially na your blood level. Even though you can say you get minimal risk, say since I go to pharmacy, I'm able to check my blood level, not just about blood, you not get like that kind of adverse effects if I take out blood medicine and this bad thing can happen. So most pharmacy then will give the malaria medicine with the blood medicine just I can say just for maybe give benefit of the doubt or just for the sake say you not get adverse effects it will cause. If you get anemia, like you solve the anemia. But even if you not get anemia, if you take the blood syrup, you know they do you bad, something like that.
So doctor, one thing we usually kind of in mind, I can be tempted for questions. If na woman mosquito they bite somebody, he gets malaria. Is it that women are more prone to malaria than men, or is it that man they want to more malaria more than woman? Has there been any study undertaken in that light?
No, so you don't get much difference in the risk between man and woman. The vaccine a woman mosquito they transfer not get anything for do with whether you a man or you a woman. Also because a woman mosquito a man they get more no than they know they. So we all get at equal. It's just that people that were pregnant, the woman, of course when a woman is pregnant they are at more risk. In fact, I make as a country, we women get belly, we the go clinic, then they give medicine for prevent malaria, I won't talk about it. Then they give them 3 tablets when they give for every clinic we go, then they give 3 tablets for prevent malaria. The reason is malaria in pregnancy can be very severe. It can make woman born quick, it can make the kidney born premature, it can make even the belly waste. So you get a lot of complications which malaria can cause in pregnancy. So now make as a country and make a policy say all the women they go to a clinic and they get malaria medicine as prevention. Every clinic we go they give for take as prevention.
Okay, in Dr. Solomon Fala for Sandy, he don't talk to me about this malaria business here. So, and doctor, tend not to be party with the time for wrap up the program. But before they wrap up the program, I go only talk to family out there. You know, it will be a word where you left with we all, or just kind of advice we go and give with regards this malaria sickness business here. So because everybody we all don't talk pepper doctor, we come by malaria business. So tell them this one, if I see everybody want small more. So tell them mommy they say, can go to that mommy banda, can go buy 444. You know, we can just do and so no more. So what's your advice for you all out there?
Okay, so the first thing that malaria is severe and it can cause very severe disease. But the good thing is now sickle we can prevent and also now sickle we cure the for. So unlike other sickness where you will take and cure on the malaria preventable and there is also cure for malaria. And for the symptoms that malaria gets, they're not specific. You know, so I make the best advice is we start to get one body, the ADRs, go to the hospital, then go do tests because malaria can cause them. We get a whole list of other things that sick that we can also cause the same thing. And for health in general, the earlier you diagnose, the earlier you start treatment, the better chances you get for recovery and the better chances you recover without complication. But as a nation, we all get responsibility for fight malaria and for prevent yourself from malaria. We don't need for it for government. Within the community, we can ensure so we keep the community clean, the compound. Even if the community not done, within the compound, ensure say we no get no small grass, no water no settle, dirty no park, we clean as much as possible. Then as individuals, we try as best to prevent malaria, mosquito for birds, so whether na the net we dey use, whether we decide for use coil or whether we decide for use spray, but then we endeavor for use something where they reduce the chances of exposure, because it better you prevent malaria than you get time you need for going to hospital, you need for do tests, need for buy medicine, and you know how the world they go now with expenses and everything. So it better that we work as a country for prevent malaria, and it's simple. You don't need for go America for prevent them. We just need for people environments and clean, and that they can help a lot in the fight against malaria.
Okay, so plenty. Thank you, family. I hope say Dr. Solomon Falafua Sandi, when a medical doctor attached to Koidu Government Hospital inside Konodo F4, you know, talk about this particular sickness. So me, you will learn so many things then, and doctor don't advise you all, and I believe so we all for take this advice there. So family, now so we did what the cutting for this edition or Wetin D Docta Say. I say plenty thank you to Una we watch this program. I say plenty thank you to Dr. Farah, and also thank you to my production crew, especially my producer Joseph Stanley. We will bring this program come to you. Me na Emmanuel Samuel. So till we meet again. Tata.